Thank you very much for inviting me to make this presentation. I'm going to just go back over my life. I'm now retired and want to explain why I'm so delighted I made the choice to become a nurse and what a wonderful career I had. And you can see here that I qualified in 1968. And the uniform of the time, I don't think anybody wears these hats anymore, but I was 21 when I qualified, as I'd started at the age of 18. If I could have the next slide, please. And I decided to specialize in sickle cell anemia, an inherited red blood cell disorder that mainly affects people who have origins in tropical parts of the world, such as Africa and the Middle East, and their descendants, of course. And I was the very first sickle cell nurse specialist in the UK in 1979, and I got the idea from visiting the United States in the late 1970s, because up to that point I hadn't been aware that nurses could specialize in this condition. And it was seeing somebody like Sylvia Lee, sickle cell nurse specialist in Los Angeles, that gave me the idea, and she very kindly allowed me to shadow her. And when I came back to London and linked up with Dr. Misha Brozovic, a consultant hematologist, we set up this first centre in northwest London. Next slide, please. When I started out, I started nursing actually at 16 as a school nurse assistant, and then did my state registered nurse, as it was called then. I never envisaged that I would have so many options in nursing, including becoming an academic and doing research. So this was sort of 3/4 of the way through my career. I became a professor of nursing at the University of West London and set up my own small research centre, which I called after Mary Seacole, the Jamaican Scottish Victorian nurse who went out to help care for soldiers in the Crimean War. Next slide, please. And, this is actually a very short presentation because I wanted to show you how, even though, I grew up in a children's home, I decided I wanted to become a nurse because of a nun who cared for me in a way that didn't cause me any distress, and I discovered she was something called a nurse. And so as a child, that's why I decided to become a nurse. I never envisaged that working in innovative areas such as sickle cell would give me this award of a damehood, and that my name's Elizabeth, and I met a much more famous Elizabeth in terms of Queen Elizabeth II in being awarded a damehood in 2017 for services to nursing, and also the Mary Seacole Statue Appeal. I joined forces with Lord Clive Soley, and the charity raised a lot of money, £750,000 in 13 years, to erect the first statue of Mary Seacole in this country, and it's in the grounds of St Thomas's Hospital in London. So in a way, I think I'm just trying to show you that you never know, regardless of your background, the health service, and in my experience, nursing offered me the most wonderful career. I also became a health visitor, became a tutor, as I've mentioned, and became the first sickle cell nurse specialist in the country. So the options are even wider now than when I was young in my nursing career. And I think it's the most, I would say, possibly wouldn't I, but I just think it's the most wonderful career if you are interested in making people feel better when they're the most vulnerable, working in a multidisciplinary team with all sorts of different professional groups, and also working with the voluntary groups. For me, it was the Sickle Cell Society, and I think it's so important that the health service links up with the voluntary sector as well. I think that might be the last slide, actually. Is it? I'm not sure. Yes, it is. So I wanted to keep it short, just in case anybody wanted to ask any questions or have a comment to ask me. Thanks.